COVID-19 symptoms vary widely, and undertesting in many countries means that many people may have already had the coronavirus without having received a positive diagnosis. Is it possible to find out, and how should you behave if you think you may have been infected? Is there any way to know whether someone has had COVID-19 in the past? The only definitive way to know that you've had it is to get tested while you have it and to have that test be positive. Dr. William Hillman. Could I have had it and been asymptomatic? Hillman, coronavirus is actually quite a significant spectrum of symptoms, from people who are entirely asymptomatic and would have no idea that they have it to people with very mild, cold-like symptoms, runny nose, congestion, sore throat, to people with more flu-like symptoms, high fevers, muscle aches, shortness of breath and cough. What percentage of carriers are asymptomatic? Dr. David Buchholz, right now in New York, we're only testing the sickest possible people. So we have no idea. However, there was a study in Iceland, which tested population, and 50% of the people who tested positive had no symptoms. Are people who are asymptomatic also contagious? Hillman, a significant proportion of people who are totally asymptomatic are contagious for some portion of time. We just don't know, at this point, because we don't have the kind of testing available to screen for asymptomatic infections. When people are symptomatic, they're contagious. A virus builds up and starts to shed, and then after symptoms resolve, people can still be contagious for a couple of days. It's hard to know if that's actual live virus, which is still able to infect somebody, or if that's just dead virus that the body is shedding. Should someone behave differently if they think, but don't know for certain, that they have already had it? If we are all in it together, we all should be doing social distancing. Hillman, since there's no real way to know at this point who might have had it, unless you're symptomatic, you get a swab and are definitively diagnosed with it, I would just act as if you hadn't had it. Keep doing all of those things that we all should be doing at this point, social distancing and hand hygiene. If I think I may have had it, do I have an ethical obligation to tell people I came in contact with, even if it may, in fact, just have been a cold? Buchholz, yeah, any family members and close friends, maybe somebody you work next to, I think I would just alert them, especially if it was in the last 14 days. Hillman, if somebody is diagnosed with a case of coronavirus, I might feel a little bit more strongly that they should tell people, because if you're in close contact with a healthcare worker, it could have implications for precautions that healthcare worker needs to take. If I've had it, can I get it again? Are people who are asymptomatic also contagious? Someone with a normal immune system that can react to the virus and get better should have immunity for quite some time, at least a year, if not lifelong.